Morning to all. As a part of 5R concept, reduction, refinement, replacement, rehabilitation, and our responsibility to carry out all these fours. Today, I will be discussing about the replacement alternative for pyrogen testing. As you know that the pyrogens are fever-producing substances usually derived from the microorganisms. Either it is endotoxins or lipopolysaccharides, and when it is present systemically in sufficient quantity, it can lead to severe sign of inflammation, shock, multi-organ failures, and sometimes even death in humans. Pyrogen can able to release the prostaglandin C2, which acts on hypothalamus and raises the body temperature through generation of the heat and also by the vasoconstrictions. The vaccines and other injectables must be confirmed to be the pyrogen free according to the regulatory requirements of 21 CFR, United States Pharmacopoeia, European Pharmacopoeia, and also by Indian Pharmacopoeia. Usually, the pyrogen test is conducted with the rabbits. Now, because of the restriction by the CPCACA and also by the Institutional Animal Ethical Committee, we have to go for some alternatives instead of using the rabbits. So the pyrogen test is nothing but the USP, United States Pharmacopoeia, considers a solution to be pyrogenic. Either it may be a vaccines or maybe a parenteral. When 10 ml per kilogram is injected into a rabbit, and there is a rise of temperature of 0.6 degrees Celsius or more for any rabbit, or the total rise of more than 1.4 degrees Celsius for three rabbits in a three rabbit test group is said to be the pyrogen containing preparations. Now, this is completely replaced by the bacterial endotoxin test, which was developed by Drs. Bank and Levin. And this method is faster, more economical, more sensitive than the rabbit pyrogen test. And if you see what is the bacterial endotoxin test, always it is called the LOL test. LOL is nothing but Limulus amoebocyte lysate. So this LOL test is based on clotting reactions of horseshoe crab, which is nothing but Limulus polyphemus blood cells, which can able to lysate to endotoxins. Now, this is the conventional method of measuring the body temperature of the rabbit, usually in the laboratory, in the college level, in the laboratory. So, this instrument is called Telethermometer, which contains six proofs at its back, and this proof has to be inserted into the anus of the rabbit to record the body temperature. So at a time we can carry out the experiments with the six rabbits. So now this is completely replaced by the LOL test. So if you see what is the principle of LOL test, the lipopolysaccharides, that is the vaccines or the parental solutions. Suppose if we have some lipopolysaccharides that causes extracellular coagulation of the blood, extracellular coagulation from the blood of horseshoe crab, Limulus polyphemus. So this LOL test is based on the three mechanisms. One is gel clot techniques. This is based on the formation of the gel. In case of turbidimetric method, it is based on the development of turbidity after cleavage of the endogenous substrate. And it can also be possible by means of chromogenic method. It is based on the development of color after cleavage of synthetic peptide and the formation of the chromosome complex. So these are the three principles which is involved in the LOL test. And now both LOL test and rabbit pyrogen test is completely replaced by the monocyte activation test. This monocyte activation test uses the human mononuclear cells obtained either from the human volunteers or from the blood bank. So this method is very specific and sensitive. The principle is we have to detect the pro-inflammatory contaminant such as interleukin 6. So if you see these photographs, the first one is it is unstimulated human monocyte in peripheral blood mononuclear cell fractions from donor blood. So this is unstimulated human monocyte in peripheral blood mononuclear cell fractions from the donated blood. When this monocyte is stimulated with the parental preparations or the vaccines which is said to have a pyrogen, there will be release of the interleukin 6. So how much amount of the interleukin 6 is liberated, that can be quantified with the help of ELISA. So nowadays, more than the LOL test and the rapid pyrogen test, we prefer the monocyte activation test for the determination of the pyrogens. Thank you.